Good evening, all. Are we ready to start? Great, thank you very much. Excellent. Good evening, all. Welcome to tonight's meeting. My name is Councillor Natalia Perez, Chair of the Health and Adult Social Care Policy and Accountability Committee. Before we start, I have a few housekeeping points. This meeting is being live streamed to the Council's YouTube channel. By participating, you are consenting to being recorded. Please, can officers and guests introduce themselves when they first address the committee? If the fire alarm sounds, please leave the meeting in an orderly fashion by the staff fire exit, which is behind me to the right. Officers will direct you to the assembly point in Riverside Gardens. Before we move on to the first agenda item, I would like to welcome Councillor Lydia Painter, who's joining us at the HASPAC committee. Welcome, Lydia. Welcome. Great to have you as part of the committee. Also, welcome to people watching online, and also, hello, Victoria, good evening. Okay. Let's move on then to agenda item number 1, apologies for absence.
Apologies from Councillor Rosenberg and Catherine.
Thank you very much. Agenda item number 2, declarations of interest. Do members have any declarations of interest? Thank you. Agenda item number 3, minutes. So from the agenda pack, if you go to page 4, the members agree the minutes of the meeting held on the 29th of January 2025 as an accurate record. Yes, agreed. Great, thank you very much. Also, to follow up on the agreed actions, David, can I please confirm that the actions were done?
Yes, we've had updates have been circulated.
Yes, Jim.
Oh, yes, there we are. At the last meeting, as the previous meeting, I had asked for a circulation of deprivation maps, and it hasn't come. So could I ask for time number 3 that we actually do have these, because it corresponds to several things on the agenda. And it's very hard, unless you've got a map in front of you, to actually be accurate rather than have a universal opinion, which doesn't fit all. So again, it would have those.
Yeah, I'm sorry that you haven't received the data. Bear with me a second.
Yeah, Jim, I just want to say my team was definitely sent them by Nikki. So if they didn't make it to the committee, that's our fault. So I just don't want to blame Nikki sent it to us. So that's my fault.
Can we please just confirm that after maybe tomorrow, can they be?
I'll send them right now.
Okay, thank you very much, David. I also know that the other action was followed up as well earlier today.
Follow up on that. On page 7, it mentions backlog on hospital discharge. And I think I'd like to suggest, because looking at the acute board and common papers for tomorrow, there's a long section looking at Northwest London as having the worst in London of backlog of discharge, unable to free up beds. And it goes through each borough, including our own, and we have a problem. So I'd like to suggest that we invite somebody from the acute trusts to come along and talk us through what effect on health outcomes this is having. So that's a suggestion for a matter which is in the minutes for a future meeting or future agenda item, because I think it's of real importance.
Absolutely. Thank you very much, Jim, for that suggestion, and we can note that and incorporate it in a future meeting.
Councillor Perez, I suppose I'd say that there's been significant improvement in the hospital discharge rates, so I'm not sure that's a particular area of challenge or scrutiny for this committee right at this minute, but it's up to you if that's something you'd want to look at.
Chair, could I say on the acute board and common papers for tomorrow, it takes a very long number of pages and is to be addressed there. but it does break up borough by borough by borough. So as a committee member, I suggest we need to address it.
Thank you, Jim. Councillor Sanderson?
Thank you, Chair. Councillor Sanderson, Deputy Leader. Could I just make a suggestion that maybe we get a written update that comes to Health and Wellbeing Board as maybe the most appropriate forum for it? And then if the committee wants to take it in future for a discussion item, we could think about it at HASPAC, but maybe Health and Wellbeing would be the right forum in the first instance.
I'm happy with that suggestion as well.
Could I just follow up on that? If it's going to be something that's discussed here and it's in a document, then it would be really useful if everybody that's present on this particular PAC has a copy of that, because not everybody goes to these other meetings. So it would be useful if it's raised here, that it's discussed here, we actually have the information at hand. If we could, please.
Can that be circulated as well, please, before it's discussed at the Health and Wellbeing Board with
Sorry,
members
Chair,
of the
just to-
HASPAC?
Yes, I think also all the Health and Wellbeing Board papers are obviously public as well. So
They're on
will be
the
publicly
council's
available.
website, yes.
That's right.
Thank you very much. Okay. Let's move on to agenda item number 4, preparation for adulthood in Hammersmith and Fulham. This item provides a summary of the progress made across children's services and adult social care in supporting children and young people as they reach adulthood. I understand that Peter Haylock, you're going to be presenting this evening?
Evening, everybody. I'll do a short presentation, then obviously give some opportunity for questions and so on. I think you've all had the copy of the slides. So just for clarification, so the preparation for adulthood is very much focused, not exclusively, but focused on our young people with special educational needs, and specifically those with education healthcare plans who are there to support those children who have the most significant needs, and kind of working through that. So over the last 2 or so years, we've been working collectively with colleagues from children's and from adults, which is now part of the People's team, to develop 3 key work streams. So very much focused in on developing a kind of workforce, secondly, developing the pathways, and thirdly, developing the provision. So those 3 things were very much driven through feedback from children and young people, and also their families, about the areas where we needed to kind of put some developments, etc., in place. So to give a little bit more detail of that on slide 3, the workforce has very much been around devising and developing a new transitions team. We received significant funding from the council to develop this team. It was first launched in 2023, now been fully recruited to. And essentially that team works and supports young people in the region of sort of 16 to 18 and then slightly older, to enable them to transition from education and from different types of provisions into different types of provisions, whether it be within adult social care or in a wider field. It's been a really successful process. We've been really pleased with the progress that's been made, and it's enabled us to kind of continue that kind of really positive work. Second has been around pathways. I'll come back to that in a second, because there's a kind of link that can show you what the pathways information looks like. And then thirdly, it's about provision. And this is the area that we're looking to expand on and continue to build upon from this point forwards. So it's looking at placement and sufficiency. It's looking at increasing our employment offer, working with the council's upstream industrial strategy policy to look at opportunities around inclusivity, etc., and look at how the types of provision for the young people are suitable to give them a good opportunity for employment, where that's the best possible route, or then looking at other potential routes as well, where there's different options that may be more suitable for them. I mentioned that I would come back to pathways. So if you look at page 4, you can see we've now got our pathways are sort of complete, and they're on what's called our local offer. So the local offer is primarily for young people with SEND, but it's available, accessible for all people. It runs through our Family Hub website, and it provides a specific kind of information around the potential transition journey for young people who would be more focused on education, those more focused on health, and those where they need more support, perhaps from social care, and also specifically for care experience or children looked after. And it gives them a kind of a key information for their families and themselves about what they should expect at different ages and times as they kind of develop through. So we're still looking to continue to evolve the service as a service. As all things, if you stand still, then you often go backwards. So we're always looking to improve and develop moving forwards. So we're doing quite significant review across adult social care, looking at placement sufficiency, looking what's available, and working with key stakeholders and partners on that, and so that is very much will be co-produced. Looking at our employment pathway toolkits and expanding our consultations with young people, as well as looking to develop and enhance our travel training offer, which is kind of key to being able to access employment and other things. Then you've got a couple of case studies to give you an example of what kind of transitions is really about, what preparing for adult is really about. There's one case study there, which is around someone moving home and that really going successfully. There's a second case study there about a young person picking up a college placement. And then there's a third, which, as you'll see by the way it's written, it's not written by me or my team, but it's written by Monique. And then so Monique is one of our young people. You can see her in one of the photos as it goes through. And we were looking at this, it gave you a kind of much better flavour than a waffling officer in terms of what actual preparation for adulthood actually means and what an internship actually is. So she's been on the Hammersmith and Fulham supported internship since September 24. The internships, as it says here, this is all written by her, are designed for young people who are aged 16 to 25. They do some work placement, they do some college courses, etc. So she's had an opportunity to work in Hammersmith Library and kind of do that piece of work there. Then she's been also doing some kind of experiences working with some of our local primary school children, etc. Then she's been working in retail. Again, another great different opportunity, different types of customer service skills, etc. Third rotation, again in retail, working in Waterstones, so just kind of continuing that kind of opportunity for progression. Again, the internships also include things around qualifications and certification, and then opportunities for enrichment and looking at what her next steps will be. So obviously the internship is a one-year program, so she'll be looking at what our potential kind of CV looks like, looking at where she's still got perhaps gaps in terms of her employability skills, etc., and what that might look like kind of moving forward. And it gives you an opportunity there to see what her kind of goals and aspirations might be for the future. So I thought that possibly could have been slightly dull presentation, a little bit more to life. So over to you guys for any questions.
Thank you very much, Peter, and thank you very much to Monique Adorno for her great presentation. Please extend the thank you on behalf of the committee.
I will do.
For her contribution. Okay, we've got Councillor Lloyd Harris and then Lucia.
Thank you very much. I enjoyed that presentation. And I would suggest if we use this almost as a template for moving forward, that we actually have somebody that's involved in the program that can actually, in their own words, convey what this means for them. Because you're absolutely right. It means so much more. No insults to anybody that writes reports, but this is just so much more appealing. So I welcome that. And I was just wondering, are we going to get a sort of a bit of a flavour of the rest of her journey, of what this might look like? Because I think it'd be nice, because we hear bits and pieces about people and it's all very positive, but it's not always going to be positive, but I don't think that's a bad thing to hear what their journey looks like. And she's done well. It'd be nice to see how she goes at Waterstones, that sort of thing. And maybe if we could include that when we have other projects that are going forward, this type of approach.
Absolutely, yeah. I think, yeah, because it's always about progression and transition. So I think, yeah, it's almost, I think they've done some TV programs, something over the time, looking at children at different ages. And I think we could continue the story, so to speak.
Thank you very much. Jim. Oh, sorry, apologies. Lucia was first, yes.
Hi. I just wanted to sort of find out a bit more information about what the transition team actually does, who the transition team is, how many people there are, and are they helping education, health and social care? Are they providing a kind of a joined up approach? And how much they feed into the UHCP?
So quite a few questions there, but I'll start with the kind of the easier part. So off the top of my head, so is it 8 people in the team? I think it's 8. I'd have to check the exact number. I do apologise. But essentially, the key thing is that they will take a referral from either the children's team or the SEN team. They will look at what's required in terms of the transition process. Then they will work with the young person. I think there's around 38 that they've worked with so far. And they will work with that young person and their family to look at what the transition plan needs to be, what the provision needs to look like, and what the direction of travel will be. They tend to very much focus more on the social care element at that stage. They don't necessarily input into the EHCP because actually part of the transition process is that their EHCP should potentially end, because the EHCP will be driven by the education element. And if they're moving into employment or moving into a different type of provision, then the EHCP wouldn't necessarily be needed. So they will be at the upper end of the cohort in the kind of the 21, 22, 23-year-olds, not down at sort of 16 to 18, etc. So an EHCP, sorry, is an education healthcare plan.
Jackie, you want to come in?
If I may, just for clarification, the team has probably got 12 or 13
Sorry,
people.
yeah,
It's quite
apologies.
significant. And it's an investment into avoiding that cliff edge that lots of people have reported when their time with children's services come to an end. And then there's too much of a clunky handover to adult services. And what we're trying to do is start to plan ahead with children and families for adulthood, starting as young at 14. We probably engage more at 16 at the moment. And part of that process is the actual work with the young person and their family, thinking about their future, but also understanding need so that we can start to commission in advance, so that young people who are 25 today, in the past, we could have engaged with them when they were 14, 15 to sort of plan and anticipate those needs. So the team has been running for a year, and a lot of it has been about getting, as Peter said, the right processes and the protocols, making sure that everybody's engaged, everybody's around the table, and it is working very effectively.
Can I, sorry, just so far, how are the cases kind of, because obviously there are a lot of children in Hammersmith with social care needs, and with education healthcare plans. So how would you decide whether it's that child, that family, or that family? Because if it's only 38 children people have been supported so far.
So it goes. It's kind of a referral process. So obviously in my team we hold all of the EHCPs. So there's about 1,800 young people with an EHCP. And obviously they're at different ages from 0 to 25. So in the first instance, what we've been looking at is kind of the key cohort in terms of age group. So looking at that cohort that needs to transition quite soon, because they're getting to the point where their EHCP may be about to end, and we want to make sure that they get to the point where that cliff edge is not reached. And then as we kind of work through that cohort, there are some young people who don't necessarily need the support of the transition team, because they'll work with the employment team and they'll have an exact plan of what they may be doing. Some of the young people on an EHCP have gone off to university. So again, it's not kind of a relevant process. So it's mainly, the assessment is mainly done by the multidisciplinary team. They'll work with colleagues from health as well, and colleagues from our disabled children's team, and look at the cohort and work out where we can best meet the needs through the transitions team. Jackie, do you want to come in there?
And if I may, Peter, I think that it's also about those young people who are eligible for adult social care services. So not every child and young person will be eligible. So we're looking at those that we are anticipating. But part of it is understanding the need better from adult social care to prepare to receive those young people as they become young adults.
I just noticed in sort of one of the case studies, it also talked about going into college, so that they're not necessarily ending education.
No, absolutely not. That's correct. So this is why it's kind of a preparation for adulthood. So there'll be different approaches. So the EHCP won't necessarily end until it needs to. It just depends. Everything's kind of bespoke based on the nature of the needs of the young person and how they're developing and what their direction needs to be. That's why when you look through the pathway documents, it's kind of sort of relatively generalized, but it gives some particular pathways for different groups of people and what that might look like.
Thank you. Thank you very much. I've got Jim and I also have Victoria online. Jim, please.
Peter, I very much enjoyed that. I worked in education, and what you're presenting in this report really was very positive as a way of actually dealing with actual needs for young people. And one aspect in particular I liked was what appears to be genuine co-design, co-production. It's often mentioned locally in NHS, but this actually seems to have built from the bottom up, and therefore is much more likely to work than those which come from the top down. And a few questions. One is, it's kind of around the equalities end of it. I was wondering, when you analyze the people, say you're a team of 38, because you're looking at 1,800, which is a large number, how are they broken down in terms of, for example, poverty, ethnic backgrounds, deprivation and stuff like that? Because it's quite important going forward that one can actually draw on actual cohorts of people to plan going forward of what you're doing. And I was wondering, because this is, I think, the council genuinely tries to be co-productive, I'll put it like that. What kind of work are you doing going forward as things change, as you pointed out, with, for example, disability communities, to make sure that the wide range of disabilities are taken into account? And the co-production, I take it, will be a continuing process, not a one-off. So my question really is how do you actually break down the data you've got, which is actually quite rich here?
So all of the EHC numbers are broken down into a whole host of different groups. So we have a very clear dashboard that will map out the local authority. It will look at the parts of the local authority which have the highest number of EHCs. It will compare that to the deprivation indices. It will look at the needs that exist, and it will look at the breakdowns in terms of deprivation, etc. That data will translate into the same. We will have the same data for the cohort of young people that are going through the preparation for adulthood and working with the transition team. Obviously, looking at 38 is far more individualized in terms of the needs, etc. So we have a very thorough data set in terms of our equalities indicators, etc. In terms of your other question, 100%. So I think the way we're looking at co-production is we're going to really drive that towards the provision and looking at how we look at what's going to be developed there. If it's okay, I'm going to defer that bit of question to Sarah, because she's kind of very, or Jackie even, because they're very much leading on the commissioning element for the provision.
So I'm going to defer that to Sarah as well, but I just wanted to say, I'm passing that. Jim, just to say that Parents Active were instrumental in driving the case for this new team, and Peter and his team continue to engage very frequently with them. Peter, Sarah, actually, and Catherine meeting with Parents Active. And Peter, in terms of co-production, you have, is it Partners in Change? And you might want to say a little bit about that continual engagement and dynamic co-production of services.
Hi, Sarah Wright, Director of Commissioning, Transformation and Health Partnerships. So yes, it's a continuation of what the work that Peter has described, really. We're at a much earlier stage in terms of the work that we're doing around adult social care, but it's about informing the way in which we commission services going forwards to make sure that we are meeting that need coming through, and taking the same approach in terms of co-production and co-design as to what that looks like. We're undertaking at the moment a bit of a mapping and review exercise in terms of what we have locally for young adults, and there is more that we could be doing in terms of providing different services in lots of different ways. So we are trying to understand what they need versus what we've got, what the gaps are, and what we could be developing differently.
could I ask a follow-up question? That's quite an interesting answer. Obviously, need is huge. 1,800 people is a large number of people, and picking out 38, it's a question about finance. Local government is not flush with money, to put it very mildly. Had you a larger budget, would you be able to expand that number you got from 38 to a bigger cohort? Is finance a kind of constraint?
So no, I think it's not necessarily about expanding the number. It's about working with the right people at the right time. So that's what that team are looking to do. So it will. I think when this was written, it was at that point, but obviously we've already significantly increased the number that we're working with, and the team are picking up as they're developing through. So I think, bear in mind that the 1,800 is split over 25 years, and we're looking at a very kind of bespoke element of the 1,800 that are very much focused in on adult social care rather than those that have got different types of pathways. So I know, for example, quite a large number of people have moved into working with the employment team over the last year, and that's kind of developing at pace as well. So I think, it's not necessarily about financing particularly. It's more about making sure we're working with the right people at the right time.
Thank you, Peter. I think Councillor Sanderson wants to come in.
Thank you. I just didn't want to get hung up on the 38 number because this is obviously a very new team that's just come in.
Yes.
So the reason that we've got 38 is because those are just the ones who've had the service so far, but that doesn't mean it's capped at 38 or that's all there is for the year. If we're dividing 1,800 by 25, it's about 70. So you're saying just over half of that cohort will have had that support anyway, which is probably in line with those who would have needed it. We're not going to come and prescribe the service to people who don't need it. Very much for people who will need that bit of additional support as they transition into adulthood, knowing how daunting that time can be.
Thank you very much. I'm keen to bring in Victoria, please. Victoria?
Hi there. Hello everyone. In fact, your previous answer may have touched already on what I was about to ask you.
Sorry, Victoria, I think we need to increase the volume, please.
Do you want to carry on talking? Is that any better? Can you hear me now? Can you hear me now? Do you want me to carry on talking?
It is improving, yes. Thank you.
Okay, sure. I'll carry on. If there's a problem, just let me know. I was saying that your previous answer has slightly addressed what I was going to ask. Obviously, this council has pioneered co-production with disabled people, and I wanted to ask you to tell me more about how co-production has worked in the field of transition from childhood to adulthood. Can you tell a bit more about the methods you've used for the co-production and how you see it expanding in the future?
Thank you, Victoria. Who wants to take that question, please?
So it's been a reasonably wide mix. I think one of the key things has been the focus groups that we've done with children and young people, and also the focus groups that we've done with adults to learn from their experiences. That's been really, really important. It's been important, as Jackie mentioned, to work with Parents Active and the families as well. So we're getting a kind of different approach from different elements. The team have been working with schools and other colleges as well over the recent weeks, looking at how we develop a vocational profile to look at what that can look like for the different cohorts of young people. Then we're going to pilot that with our care experienced young people and bring them on board in terms of what that will look like, and give them the opportunity, essentially not like a CV, but it gives them the opportunity to develop what's required, and then we can look at their kind of bespoke needs and go from there. So it's very much an evolving process. The absolute key to it has been the young people and adults themselves, because they are the people that experience the versions of the world and what some of the challenges are, and then how we can look to support them moving through. So Action on Disability have been really fantastic in terms of working with us. The internship team there are great, and they're giving us an opportunity to talk to a few young people and go from there. So it's been very much focus group driven. We do surveys and things like that with schools as well, but that doesn't really give us the rich data that you get from talking to people.
And have you sought feedback?
Victoria, do you have a follow-up question, please?
Sorry to talk over you. Have you sought feedback from young people as to how they found the co-production process? Did they have any sort of suggestions as to how it could be improved in future?
Not specifically, but we can try to.
Sure. Thank you.
On this point, I wanted to ask, in terms of the priorities that have been identified as part of the co-production, which I commend in terms of what has been done with the families, with young people and children, how often is this strategy reviewed? Is there like a strategic approach as well to establish whether those priorities remain, or maybe are new emerging needs that need to be addressed, or maybe other voices as well that you want to incorporate as part of this process? Thank you.
It's pretty organic at the moment. I think it will, it's pretty much once a year, really, in terms of an annual process, because we're still learning. And I happily say that, as Jackie was saying before, it's a new team, it's a new process, and to be frank, we don't really want to rest until it's really excellent, because there's just too many opportunities that you could potentially miss. So we're really looking at, especially around the provision element, which obviously does have a potential challenge in terms of finances, don't get me wrong. And I think looking at how we're utilising our businesses, utilising things like our social value contracts and all of that sort of stuff, there's all sorts of opportunities that we want to analyse and develop moving forwards.
Thank you very much. Lucia.
Just one further question. Just looking at the local offer, I'm just wondering, as a parent, how would you go about contacting you if you want to be one of the people who are supported by the transition team, or do you pick the people? Because I mean,
so
for
if
parents and part of Parents Active, it would be great to know how to.
So it's initially it's through your annual review. So and through your EHC coordinator, and they would give you the best link in, and they will then can work from you from there, basically. There is also contact details, etc., on the local offer, but it's very much driven by the annual review and the EHC coordinator.
Thank you very much. I have a question about young people that may leave the borough. So what systems are in place to make sure that the support is there, or is that support going to be provided by a different local authority? Are there meetings between among services that support that person to make sure that the right support is in place?
It is a real challenge if a young person moves away, because their EHCP moves with them. Where we have people in our virtual schools, so the children who are care experienced, they stay with us, and there's a sort of term called belonging, which is probably the right word. So they still belong to us, which is absolutely right. But if a young person moves away, they do move into a different authority. That different authority, unfortunately, probably will have different systems. So it is quite a challenge. But likewise, we will get young people that move into the borough, and we will pick up their EHCP. We'll do an annual review. We'll look at the right placement for them, and then we'll look at the right pathway for them. So it is a joint approach in that sense.
Thank you very much. Councillor Sanderson?
Thank you, Chair. And I think on that is one of the areas where we are really set apart, because there aren't that many places that have got transitions really right. It's complex, it's no one single event, it's a gradual process that should be started as early as possible, and it often falls by the wayside. So the fact that we've got dedicated funding, quite a sizable team, and thinking really proactively about how we have a holistic handover as people move into adulthood, I think is something really wonderful and should be recognised. We've also, I'm just going to do a plug, because we have just won an award for our local offer on the website. So I have plugged that every committee where we are mentioning SEND, but we are very good at both communicating what our offer is and the offer itself. So parents and young people should feel reassured that they are getting a very, very good offer in Hammersmith and Fulham and the right level of support. Thank you.
Thank you very much, Councillor Sanderson. I think it's a great summary, and it's really good to hear more about this project, how it was co-produced, and how the plan is there to carry on engaging with families, young people, children as well going forward, and the reassurance that Councillor Sanderson as well has just given us, and congratulations on the award. That's really good. Any other question, comment on this agenda item? Okay, thank you very much. Great. So let's move on to The next agenda item number 5, Hammersmith and Fulham Health and Care Partnership Priorities and Governance 2025-2026. This item from the Hammersmith and Fulham Health and Care Partnership presents the overarching plan, priorities and governance for 2025-2026. And welcome, Caroline.
Thank you, Councillor Perez. So the presentation, thank you, thanks. Jackie's got a paper copy. Thank you very much. The presentation seeks to outline the plan that the refreshed partnership set back in. Yeah, if that would be helpful. Yeah. It is. Yeah, it was in the agenda. Yeah. So the partnership had a refresh back in autumn last year, and the plan sets out the key areas that we want to work on together. So this is the organisations, actually, these are the things that they'll work on together rather than the things that each organisation will work on its own. So what we wanted to do was to set a small number of priorities that mean we can take meaningful action together. And we were informed in that partly by some of the insights that we've gathered. There's a selection there from the shared needs assessment on page 30, which is something that was published last autumn, but of course there are other insights that inform the work of the partnership, but particularly highlighted the needs which have the biggest prevalence, inequality, unmet need and overall impact. So having the lowest 3-year life expectancy at birth for 2020-2022, and the level of the population in the core 20 most deprived areas, which is higher than the North West London average, the pockets of deprivation across the borough, which I know people are very familiar with, and the higher risk among older adults of physical inactivity, smoking and substance abuse, and higher rates of anxiety, depression, cancer, COPD, falls and stroke. So those were some of the considerations. I think one of the things that will be familiar to people at the committee is the level of fragmentation within our partnership and how over the years the number of services that have been commissioned from different organisations has multiplied. And so, for example, for community and mental health services, we have something like 5 major NHS trusts providing those different services, which presents a big challenge for us. And that is one of the reasons behind some of the feedback. So I included some very high level feedback that we hear about our services. So although most individual services are rated really quite highly and we've got high quality providers, the care that's provided is often perceived as fragmented and disjointed between providers, including between health and social care. Experience of general practice is variable. There are significant inequalities in experience of accessing healthcare and a lack of trust in large organisations, particularly within some of our Black communities. We've received specific areas of feedback about patient transport and disabled access, and people experiencing a lack of continuity. So my role was created, I think people are aware, I started in July last year, and it's the first time for some time that there's been a dedicated partnership post, but it is just me. So my role is a convener of people to come together. So what the partnership does is bring people together to take collective action, and where there isn't that will to take collective action, then things it may take longer time, a greater amount of time. What we've done over the last year is to refresh the purpose of the partnership and make it clearer, shorter and clearer, to be clear that we're working to improve health and wellbeing together and reduce health inequalities, to develop more integrated and connected services, and deliver tangible improvements that are better for the population and more sustainable, focusing on tackling the wider factors that influence health and wellbeing, and working with local people to develop the trusting relationships, empower communities and co-produce service changes. And our two priorities are around creating health, by which we mean all our work on the wider determinants, on health inequity, on empowering communities, on leveraging social capital, self-care and independence, and ensuring a focus on children. And that's got very strong links with the Hammersmith and Fulham Health and Wellbeing Strategy. And then integrating services, by which we mean joining up services for people with more complex needs, and developing more accessible services with better quality of care, reducing repetition and duplication. And then what I've done is to include a description of neighbourhood health. I think people will be aware that that's one of the government's key priorities, and we're anticipating guidance to be published as part of the 10-year health plan. Outline guidance was actually published back in end of January, early February. And yeah, so I think we're still on a journey to developing what our neighbourhood health strategy actually looks like in Hammersmith and Fulham, but we thought it was important to include an explanation of what that might actually mean in practice. And then coming on to the priority, to the partnership work streams, sorry. So I think one of the things that partners all felt was that we've got some really key issues in some of our pathways for people with more complex needs. So older people and dementia, our adult mental health, and children and young people who may be in crisis or have additional and complex needs. And interestingly, the national guidance, the national NHS guidance, did ask people to focus on those complex needs pathways, again, when it was published in late January, early February. So we're focusing on those three areas, and with also a priority work stream around health creation and community empowerment. And then we also have refreshed our governance to make it clearer and reduce the number of meetings, because I think partners fed back that there were an awful lot of partnership meetings, but it wasn't clear what we were actually delivering and driving together through all of those. I'm happy to take any questions.
Thank you very much, Caroline, for the presentation and the summary. Okay, we've got Councillor Lloyd Harris.
Thank you very much for the report. I'm going to ask my sort of stock standard question, which is, we've got all of this information about areas of deprivation. Now, it says areas of deprivation in the north, White City and Wormholt. Totally accept that. But the way these things are phrased are as though it's only in the north that we have areas of deprivation. There is very rarely any impact or input on what happens in Fulham. It's as though everything is wonderful and terrific in Fulham, and it is not. It's not even close to it. So, and also the issues that are noted here about poverty, overcrowding, high crime, all of those things, wherever they actually congregate, are impacting on our rates of suicide. So it's something that's happening across the borough. So when are we actually going to get a more, what I would say, a more balanced view of actually what the borough looks like, not just north?
I think it's very clear and bold that there are pockets of deprivation across the borough, and that just mentions the largest. There's no intention in this to be fully comprehensive. It's very much a high-level summary, because that's all that we were able to produce within the resources that are available.
Thank you very much, Caroline. And I think this question has been made in the past, but we've always received reassurance from officers as to how the data is a good representation of what's happening across the borough, both north and south.
Just to follow up that, well, given that it does come up quite a lot, is there a possibility of actually putting some of the areas in? So if we had Jim's view on the stats for various areas of the borough, that would actually help us know where the areas of deprivation are you're talking about. So it would make it more, it would be a fuller picture of where we are.
Yeah, I understand the question, but we have a joint strategic needs assessment within the borough, which is really comprehensive, and that would outline, and that's what we would rely on for more detailed work around the needs of the whole population. So, for example, when we're working around Fulham, we would work together with the GP practices in that area and understand the perspective of the local residents of that area. But this is simply a high-level overview, and as I've already explained, there is only me in the partnership team currently, so it is necessarily a high-level overview. There's lots of underpinning information that's already available to support that analysis and work more locally within communities.
On that basis then, from what you said, that sounds reasonable, but I'm not actually asking for something to be produced that is not ordinarily available. So would it not be just a couple more lines? Is that possible?
I think I've got
Just
Councillor
to
Sanderson.
reassure the committee, obviously College Park and Aldoak, which I represent, also scores quite highly in deprivation factors. I do know that from all the work at the ICB and at the levels, there is a huge amount of work going on cross-borough. I think it just happens to be in this PowerPoint, it's been referenced, just those two was, but I'm sure in future PowerPoints we could do a breakdown of the whole ward of deprivation in each area. Because that's it. I think we know that there are pockets, obviously all over the borough, which need a bit of additional, but just to reassure, there is work happening absolutely everywhere.
Thank you very much for that reassurance. We've got Dr. Lang, you wanted to come in?
Yeah, just a quick one. We have very detailed documents all in the joint strategic needs assessment. We love our wards very much. We have individual bespoke ward profiles, so we can share all of this with you. And we do have a focus on Fulham, all of it, but particularly Lily, North End Road and Sands End area. But yeah, we're always there.
Thank you very much, Dr. Lang. So shall we agree that as an action, please, to share that information?
Yeah, there's lots in there. I think I probably just need to put an email with the, yeah, it's all there. Yeah.
Thank you very much, Dr. Lang.
The question actually is quite substantial, because what we have is the PowerPoint, and we have to make a judgment on the PowerPoint. And I take your point entirely, Caroline. If you're working by yourself, the amount of work must be quite extraordinary. But nonetheless, if we're to make an adequate judgment, one actually does need a tacking down of empirical material. For example, I live in the south of the borough. I've worked in the middle of the borough, educating people from right in the bottom up to the very top and beyond. Clementley Estate and around there is one of the poorest in the UK. It is a substantial estate. Sullivan Court near it is very substantial. Fulham Court near it, part of Harlem Court needs a lot of work. So there, what Nikki's talking about, I think that information needs to get around, else one is actually involved in faith, accepting something as adequate without the underpinnings. I wouldn't have got away with that myself in education from Ofsted, and it's an ongoing thing. But I've got a couple of different kind of questions, though. Is this trying to understand how this would work? It's not easy, actually, and I'm very strongly in favor of integration, so don't get me wrong. I think integration worked well, can actually improve health a great deal. But looking at the maps around, I see, for example, our whole work programs and work streams, and there are actually three INTs, North, Central, and South. And each one is given a different color coding above it. Health creation is one, adult mental health, and the one, quite fittingly, older people and dementia is in the South. Well, I live there, so I'm looking forward to that. But what occurs to me as somebody who knows the borough well, I've lived here for actually most of my life. And I've worked here for much of my life. I spent much of my life walking up and down the borough. All of these actually, they're germane to very, very large cohorts of people everywhere. And I'm wondering how it is they managed to get a heading for different INTs. And further, there's been much work, an amazing amount of work done with some success over the last couple of years to actually build up PCNs, primary care networks, getting doctors for the first time to work together with many other professionals. And no matter how I look at it, I cannot see how say, a PCN in my area, which is hardworking. We got the best results, for example, when both survey and GP access came out, how this will actually map onto 3 INTs. And I've got a range of other questions as well. There's a fun thing, and this goes back to the earlier and this one, is when Peter Haylock gave a presentation, I was very conscious of co-production as a practice. What he offered came from working with people, drawing from people, and building on what interest groups, disability groups, parents groups, and others, what they saw. But when I read this and I looked at the documentation from what was NHSC, it is much the same with Hammersmith and Fulham data put on the side, helpful data actually, but there's no flavour of bottom-up co-production of a way by which a resident patient would actually feed in to what patient groupings might see as most appropriate for their area. It very much is top-down, and as Lord Darcy pointed out in his quite interesting report, top-down doesn't work. So it's how to turn this around to turn it into a bottom-up, responsive organising tool. Because at the moment, it's very much what somebody in NHSC, or whatever it's called at the moment, has developed for the whole of England. And it does not have a local flavour beyond the figures which you quite helpfully put in about poverty, etc.
So the first question, Jim, was about the coverage across the borough. So yes. I think what the diagram's trying to show is that what we are intending to do is to work specifically in one local area, but then spread the approach to all our local areas. And that's because, as you rightly identify, there's only so much capacity, for example, within general practice and our PCNs to focus on particular things at particular times. So the idea being that we work within a particular area to develop a way of working and with a local population, and then we spread that over time. I think this was the second point about the
matching of ITNs with PCNs,
the
and
matching
the actual work which is ongoing and is fruitful and is responsive to known populations by people who work there day by day, with patients who live there day by day.
Yes, so I think our PCNs are broadly happy with the way they're mapped across to the geographical areas. I think one of the challenges for us is in particular that in that central area, the 2 PCNs have practices very close to each other, but they're in, and it's really important that we can actually work with a population, as you identify, because otherwise, how would a person know which piece they're not necessarily interested in which PCN they belong to? They're more interested in which local area they live in and which neighbourhood they identify. So I think that's absolutely right. And the 4 PCNs that would need to work together in the 2 neighbourhoods are actually all part now of a single GP collaborative across. It's only the North practices that are not involved in that, and they're a standalone neighbourhood in this terminology anyway. So I think that mapping actually works quite well. And I think what we're really clear about is that they're not really neighbourhoods in the sense that local people would understand them, are they? Because they're far too big. So within the central area, for example, there's the North End area that you've rightly identified as an area of higher deprivation. There's Hammersmith and there's Shepherd's Bush that people might identify, and Brook Green that people actually identify as areas and neighbourhoods that they live in and very much more local to them. So that's absolutely right. But I think what we're confident is that we could wrap support over time around those localities and then work with populations within those neighbourhoods. In terms of the top-down and the co-production point, I think I don't disagree with you to some extent, Jim. I think that that we're still at the very early days in terms of partnership and doing the co-production bit together. We are dipping our toes in the water of that with some work, but it's very early days. I think that particularly the adult mental health, the older people and dementia, and the children and young people, the co-production really would be with those individuals, because they are often people with the most complex needs, and seriously, severely unwell, and they're the people that we're trying to work together around. But the co-production in that sense would be with the individual and their family and those who are important to them.
Yes, Jim.
Could I come back on that, because I think that's quite important. I think Darcy pointed out at some length that what actually comes down, unless it actually represents what happens in actual communities, rarely works or is less successful than it might be. And it's not we work with them, because that's not co-production. That's actually top down, no matter how localized you make it. It's how within, if there are 3 INTs, which are going to organize a lot, how the populations within those INTs, how they themselves meet, make priorities, talk about what they perceive, because it's not that Fulham or Hammersmith it's not a large borough, 183,000 plus a few, but there are identifiable neighborhoods. And those of us who live there, which I've long lived here, is we know where we live. And I know your end, simply for teaching kids from there, a huge number, or meeting parents, or going there, but actually live in a different area, which is very socially mixed, very ethnically mixed in lots of ways. There has to be a way by which the population there identifies their priorities. Else, it's very hard to see how things will work to improve. And I know that's what you want, is to improve health, but the involvement needs to come from the start within communities.
Thank you, Jim. Meryl, I know you had your hand up. Yes, you're welcome to ask a question.
I just want to, Meryl Hammer from HAFSON, and a member of the public, and someone who is deeply concerned about, having read this, about the issue of co-production and about just when local residents are going to be engaged in co-production on this. Because in reading through the papers, and because of my involvement, which Caroline is aware of, in a range of other meetings, and having tried to raise this question multiple times beforehand, I still find that co-production and the engagement of local people in this process and in developing plans is something that's tacked on at the end. And this borough has a good record on co-production, and I think the previous paper was an excellent paper, showing how even young adolescents with a wide range of special needs can contribute to the development of policy and practice that affects their lives. Yet I cannot see that in this set of slides here. And I think the most significant one that I ask Scrutiny Committee to give some attention to is that it's the tacked on nature, it seems to me, comes out very, very clearly in the final sentence on the final page, clarifying our arrangements, and it's never made clear in any of the papers who our or we are. I don't know. There was no header paper for this to say who'd written this, who'd been engaged in developing this paper, and that I'd actually finished reading the previous paper and was halfway through this one when I thought, hang on, there's something wrong here.
Thank you very much.
And had to go back. But the last sentence is clarifying our arrangements and planning improvements for engagement and co-production with local people. The local people should be involved.
Thank you very much,
in
Mariel.
that.
I know your question, and thanks for your questions. I know, Councillor Sanderson.
Thank you. I just wanted to, thank you so much, Meryl. I think I just wanted to really draw the distinction between the local authority, where we are very, very strong on co-production, as you'll have seen from the previous paper. And in fact, it kind of runs through everything that we do with engagement. I think we probably would welcome a little bit more clarity about some of the NHS co-production. The ICBs have got various co-production policies in play. I know Nottingham's got one at the moment. So maybe we could task as an action to look at ICB co-production, or maybe just come back to us with what co-production might look like for North West ICB, which I appreciate isn't necessarily you, but just maybe sending that back up flagpole to ask for where the ICB might be on it, because I think we probably would like to see. Thank you.
Yeah, I guess I can't really answer for the NHS because the partnership is all partners in the local area, and that includes the council. And I think one of the challenges for me is that the partnership proceeds at the pace of the slowest. And for those who have when partners are ready to engage in doing work together, and we are still at early days, and I can't. I would love to be doing more that is a bottom up, but if partners are not ready to do that bottom up work together, I can't magic that up. So this isn't about the NHS or about individuals within the partnership, but what we actually do together. I think we are, as I said earlier, dipping our toe in the water with a piece of work, but it's very early days, and we wouldn't be ready to bring that back until probably a couple of meetings' time.
I think that would be fine. I think probably we're very keen to do co-production. If there are other partners that are very keen to do that, great. I think it's just thinking about that pivotal role in bringing those groups together. If there are people who are moving more slowly, how do we demonstrate best practice from what we're doing here or elsewhere to bring them all together? And anything that we can do to help facilitate to move some of those people along a bit more quickly, I think we'd be very keen to help out. Certainly I go to lots of meetings, so I'd be very happy to try and urge someone to move a bit more quickly in co-production if you'd like them to.
That's appreciated.
Yeah.
Thank you very much. I mean, and we note from the presentation as well, that, I mean, as part of the partnership, we've got healthcare planning, local council, voluntary and community sector, organizations, GPs, and the wider primary care services, hospital services, mental health and community services, and community healthcare services. So I know what you're saying in terms of the variety of partners that you have in place, and everybody needs to be, joining at the same time.
Yeah, I think that's right, Councillor Perez. And I do appreciate that I hadn't included a list of the members of the partnership. So I'm happy to send that to David afterwards, if that would be helpful.
Thank you very much. And I note the recommendation that Councillor Sanderson has in terms of how we try to incorporate some of the co-production element going forward. Noting as well that there are some challenges at the moment as well. Thank you. Councillor Harris.
Yeah, it's just a very quick one. I'd actually like to endorse that, because I think if this is a question that keeps coming back, then obviously there has not been a response that's actually matched with any sort of, hope going forward. Now, you've quite honestly said this is very early days. So surely this is a perfect opportunity, for whatever additional skills you have, to encourage people that this is actually what we're looking for, and actually it's going to help moving forward. Because if we wait till everything's set in concrete or stone, whatever it might be, then we're too late. So this is something that could be done. It might have to be a more subtle approach, I don't know. But nonetheless, I think we're all coming from the same sort of page on this, that actually something needs to be done, because Meryl can't keep regularly bringing this question up and getting, not the answer one is hoping for. So can we leave this in your hands?
You absolutely can, as convener of the partnership, and we will. I'll do my utmost to help the partnership to move forward.
Thank you very much, Caroline, for that. Sarah, you wanted to come in?
I'm not sure if I was going to muddy the waters even further, but I was just going to say it doesn't preclude any of the individual organisations and partners around the table from doing co-production. We're all doing that. You've seen that from what the local authority is doing from Peter. That's one example, but I know that there are other pieces of work that other individual organisations are doing. We know that we've had a recent report from AOD in terms of some of the ways in which our hospital trusts can do things differently and work more effectively through organisations like AOD. I think as individuals, we're all doing the best that we can to engage with our communities and learn and improve our services. What this is about is how the collective we as a system can work more effectively together, given that we are all so massively fragmented and we don't work particularly well together, and that does make things really complicated for our residents to access. Unless we're all on the same page, it's going to be really, really hard for us to work with our communities and engage them on serious issues for them, and then for us to be able to work together to change our services together. And that requires trust. That requires us to be able to work together in a very open and transparent way. But I mean, I've struggled to understand our health partners and who I need to talk to sort out various different issues. And until we've built up, and that's why we're talking about that kind of early days place, that is what we are trying to do, is actually at least get all of us around the table and be able to talk sensibly to each other about how we deliver our services, and then think about how we can then work together as a team to engage with our communities to change our services for the better. But it's really difficult.
Thank you, Sarah. Yes, it's early days as well, but I note the efforts that you're considering, and hopefully in the future we'll hear what potential solutions could be suggested and acted on to follow up on the issue that has been raised by Meryl. Thank you very much. Jim, do you have a follow-up question?
Well, it's a question, comment, that, like it or not, there are loads of good things in this, which happen in this borough, but I'm thinking of admirable things, like, for example, the disability policy was put together by disabled people. It came from their perceived needs. The Older People's Commission was staffed by older people. The homelessness policy was put together working from homeless people, with the council giving support. I know there's a women's commission now working, but it's run by women, with the council facilitating, giving information and stuff. And I think that means there's a far more, how to say, responsive, integrated borough than we would have had otherwise. And it's that kind of model which takes time to build. But if you do so, whatever services come out, in my view, have greater bite in the community, because it's community ownership, and you get much better responses. And I'm thinking things that, for example, we know don't work well. Smears way down, vaccines were way down, because this is good information which comes from the ICB and from the acute sector. Tackling that means you need to engage people downstairs first, as people say, well, that's them. Down here, it's different. And that takes time, but it works.
Thank you very much. We have further questions, comments? Yeah. Victoria? Okay, well, thank you so much. I think we are asked to, the committee is asked to note the update. Noted? Thank you very much. We've also had very interesting discussions as to what we would like to see going forward, and Caroline and Sarah have made some suggestions. We note as well that it's early days and it's a big partnership, and some of the challenges that come with this process, but we're still going to think of possibilities of incorporating that co-production element as well, with some of the recommendations as well that Councillor Sanderson has made. Thank you very much. Okay, the next agenda item is dates of future meetings. The next meeting is on the 24th of June 2025. And before we finish, is there any other business? Is there any other business? Victoria, do you have? Okay, great. Well, thank you very much. I'd like to thank everyone for attending or watching tonight's meeting, and I hope you all have a lovely rest of spring. It's really nice and sunny, so hope you are enjoying it.
Congratulations on finishing before 8:15.
Okay.
Well, there's not even a football match on.
Thank you.